I think any woman who needs, say, gynecological surgery, that is at this point in time, I will say some size and say if the uterus is very large, that has some impact upon that. Um, those who would prefer just cosmetically to have just one incision, which tends to translate usually into less pain and recovery. Okay, but there are limitations because you don't have the same kind of flexibility in the instruments that you're using currently to provide that surgery. So it does make it more difficult. So that does limit you. So typically size, if there's a tremendous amount of scarring and a lot of other things that have to be dealt with, if the anatomy is so abnormal, I think the more flexibility you have in the surgery, the better you can do the surgery, which then pushes you to multi-port. So now many people, well, I'll say a couple of people I know, well, what they'll do before they even make that final decision, they won't say we'll do just single or multi-port. When they're talking to their patients, they'll say, let me look inside first. And if it looks like this is going to be a case that I can do with single site, I'll do it. So a lot of it has to do with the ability of the surgeon. Some surgeons, obviously, just like, people who do other things, some will attempt to do much more difficult surgeries than others. And others will say, no, I can't do that. Let me go to a multi-port where I have much more flexibility. So I think that's what really makes a difference. But in general, typically anatomy that's not huge, and the woman who wants a nice cosmetic closure, and many times that's younger women.